When you do PGT on embryos for IVF, the result is not necessarily going to be binary, normal versus abnormal. I'm Dr. Lucky Seekon, a double board certified OBGYN and REI, and here's a breakdown of the possible results that you can get on your PGT report and what they all mean. The first possible result is what we all hope for, a euploid embryo. This is an embryo with the correct amount of DNA, 46 chromosomes or 23 chromosome pairs to be exact. These embryos have the highest chance of implanting and resulting in a successful pregnancy. And while you can never say success is guaranteed, there's about a 70% chance that you could get pregnant. And within 3 successive euploid transfers, we can usually offer about a 92% rate of live birth. Next, we have an aneuploid embryo. This is where all of the cells that were taken from the embryo for testing come back showing an incorrect number of chromosomes, either having too many or having missing chromosomes. These embryos are unlikely to implant. If they do implant, they're most likely to result in a miscarriage, or they can lead to genetic conditions like Down syndrome, where there's 3 copies of chromosome 21, to name one example. These are embryos we do not recommend transferring. The next possibility is pretty frustrating when it happens, where you get no results. This is an indeterminate or inconclusive result. This is a situation where you set out to do the genetic testing, but it didn't provide a clear answer. And it can happen due to technical issues with the biopsy process, more likely issues with DNA amplification, because you're working with such small amounts of DNA that sometimes you can't reliably amplify it to analyze it. Now, if this happens, you can consider retesting the embryo. And we actually did a study at our center a long time ago where we looked at embryos that were indeterminate and that eventually were rebiopsied and found that being indeterminate doesn't mean anything about the embryo's quality. After rebiopsy was done, the rates of abnormality were what you would expect per age for that embryo in patient. If you have an indeterminate embryo, you have options, right? You can say, I'm going to do nothing and just choose to transfer it blindly as if I didn't do PGT at all. But you could also thaw it, rebiopsy it, and refreeze it. Now, that is an additional exposure to the embryo, and according to studies, some show a decrease in implantation rates of up to 20%. In my experience, it's less than that, but it could drop the reproductive potential and thaw survival by a few percentage points. So this is a really individualized decision that is going to be impacted by factors like, what is the chance that this embryo could be abnormal according to the age of the egg that the embryo came from? Or are there other reasons why you really want to get this definitive PGT result? For example, if you were doing PGT to test the embryos for a specific genetic disorder. When I went through IVF as a patient and created embryos that were tested with PGT, one of mine actually came back indeterminate. Because I was under age 35 at the time and I had other euploid embryos to work with, I decided to leave it unbiopsied. It was a personal decision. I figured if I got that far down the line where I needed to use that embryo, I would be okay with transferring it without knowing the result because my age-related risk of having an aneuploid embryo was quite low. But it is a personal decision and there's no right or wrong. Next, let's talk about mosaic embryos. This is a major source of confusion because this refers to embryos where the biopsy sample had a mix of cells with normal numbers of chromosomes and an abnormal number of chromosomes. And this can vary. There are some samples that will have a high proportion of abnormal cells. These are called high mosaics, and others that will have a lower proportion of abnormal cells with an abnormal number of chromosomes, and these are called low mosaics. We can and we do transfer mosaic embryos, and I have had patients who've had live births from their mosaic embryo transfers. Patients are counseled that mosaic embryos tend to have a lower chance of success, a much lower chance of implantation, and a higher risk of miscarriage. And there can be associated medical issues and risks depending on the chromosome involved and what genes those chromosomes carry. Embryos they will continue to grow and divide after the transfer, which is why we think some mosaic embryos can self-correct and have reproductive potential, where the normal cells divide more and take over the entire embryo. Any patient who is considering transfer of a mosaic embryo will meet with our genetic counselor for a very specific counseling discussion so that they can make an informed decision. Okay, lastly, we have something called a segmental aneuploid embryo. Now, this is something that we've only been able to detect more recently because of the improved resolution of PGT testing, allowing us to really zoom in and identify when an embryo has a structural abnormality affecting only a part of a chromosome. So you can have a part of a chromosome that is missing or gained rather than having the whole chromosome duplicated or missing. So in this case, all of the cells that are biopsied and removed from the embryo have the same abnormality. Either they're missing or they have extra pieces of a chromosome. And this can occur due to duplication or deletion of a segment of genetic material. It's an error that can happen. Now, we know some segmental aneuploid embryos can result in successful pregnancy, but the outcome is really going to depend on the size and the location of the abnormality. There's one tiny study of 25 embryo transfer cycles that were done where segmental aneuploid embryos were transferred, resulting in a total of 6 live births. That's a 24% live birth rate. None of the babies were detected to have any abnormalities on their genetic testing, and they seem healthy, which is reassuring, but we lack the necessary long-term data to really know for sure. So most of these types of embryos are being transferred as part of research currently, and we lack the necessary data at this time to support the routine use of these embryos, but that's probably going to change over time as we get more information and become more comfortable with it. So that's it. Those are the 5 major possible results that you might get on your PGT report. Let me know what questions you have in the comments.